uh, from the National University of San Luis in Argentina. She's a researcher at the National Scientific and Technical Research Council in Argentina and an associate professor at the School of Psychology at Aconcagua University in Mendoza, where she is also a professor of neuropsychology specialization. She will present on strengthening children's executive functions during the COVID pandemic. Celina, over to you.
Well, thank you, Peter, for your kind presentation. Before I begin, I really would like to express my gratitude to Dr. Brian Gerard for his invitation to participate, to all of the members of the symposium that I delight to see you all, really, to all the presenters because of their valuable contribution. Really, I have learned a lot, and I really say thank you to all of you. Well, I'm going to try to share my screen. Can you see that? Yes? Okay.
Yes.
Well, I hope not having more connected problems. Just a minute, I am trying to. Well, I'm sorry. Well, I'm going to, what I'm going to talk about today is about strengthening children executive function during the COVID pandemic, school-based intervention approaches. As we have been discussing, the COVID pandemic spread throughout the world, causing millions of illnesses and death. The measures adopted to prevent the spread of the virus have generated drastic changes in people's lives. So it's necessary to assist vulnerable population, especially our children. It's necessary to assist children to lessen the impact of the pandemic consequences on their integral development. And in line with this proposal, the main goal of this study is to present a set of evidence-based approaches and strategies for teachers to help children lowering stress and promote executive function during the COVID pandemic. COVID pandemic impact on families, a serious impact on families, and as we can see, families have experienced economic and social challenges, which has generated crisis and emotional stress in both adults and children. Pandemic stressor has been identified. For example, fear of illness, loss of family members, quarantine, loneliness, social isolation, financial instability, homeschooling, social distances. And we know that stress, especially chronic stress, can impair physical and psychological health, well-being, and quality of life. Children have experienced significant changes in their daily lives, in their daily routines and activities, as well as long period of lockdown and social isolation. This situation has been linked with an increase of children's emotional distress. And some researchers have studied this during the pandemic. Here is an example. This is a qualitative art-based research where authors analyzed children's drawing during the pandemic. And they found that the drawing showed a great fear of infection during the pandemic, showed that children experienced loneliness, felt sad, and felt depressed due to the home confinement and the social distancing time. Also, drawing show a high level of distress and anxiety. Another interesting research is an internet survey run by UNICEF, where 3,000 children and adolescents participate. 38% of the children felt distressed and 24% of the children felt depressed. And the main concern of the children was family member will become ill or die from COVID, running out of food, lose job of family member, and be unable to pass the school year. As we can see, children's emotional distress really can impair adaptive coping and can negatively impact children's academic performance, cognitive functioning, and social and emotional development. So here arises this question: how may the pandemic impact child development? Well, there is not an answer just for this question, but some hypotheses have been outlined. First of all, a detriment on child health and quality of life, caused by the increased symptoms of anxiety, depression, unhealthy lifestyle habits, sleep disorders, abuse of the screen time. Also, a school closure may cause academic delay and increased school dropout. Also, restricted relationship, especially with peers, may impact socio-emotional, cognitive, and linguistic development trajectories in children. Thinking in the focus of this study, it was very interesting to understand how may the pandemic impact on cognitive development of the children. Here have been documented or reported two possible lines. First of all, it's about the contracting the COVID virus, and the other is stress. Studies done with adults have shown that between 36 to 84% of the adults infected with COVID present neurological alteration. And mild neurological symptoms have been identified, such as loss of smell and taste, headaches, dizziness, and more serious symptoms such as encephalitis, stroke. Also, it has been documented that COVID infection is associated with neuropsychiatric complications and cognitive alterations. In the case of children, newborn, and there have been some studies in newborn infected with the virus. And newborn infected with the virus born preterm, and in some cases, they show irritability, difficulty feeding, and hypotonia. Also, it has been observed that maternal infection could lead to neurodevelopmental changes in the fetus and increased neuropsychiatric incidence rates. So it's very important to understand how the virus, the COVID infection, really could affect brain functioning, cognitive development, and behavior. But I think that the link, which is really the most important, is the stress link. Because we know that the stress really impacts on immune and hormonal system and may cause neuroinflammation, and by this way damage the central nervous system, and by this way could impair cognitive functioning. Studies done with children during the pandemic and previously done has shown that children stressed show difficulties in cognitive functioning. For example, they show difficulties in focusing and sustaining attention, memory problems, irritability, difficulties in emotional regulation, and alteration in executive functions. Executive functions are among the cognitive systems that are most vulnerable to environmental stress. What are executive functions? Well, executive functions are a set of higher order cognitive abilities that control behavior, emotions, and cognition necessary to achieve a goal, to solve a problem, to provide adaptive responses to novel or complex situations. Three core executive functions have been identified: inhibitory control, working memory, and cognitive flexibility. From this one, others, more complex executive functions are built, such as metacognition, organization, planning, decision-making, fluency. What is important to point here is that this set of higher order cognitive abilities work together and enable the self-regulation of the behavior. Executive functions play a critical role in cognitive, social, and emotional development of children and predict many life outcomes. It has been reported that children who show greater executive function are more able to adjust behavior to context demand, to establish positive relationship, to regulate emotion, to tolerate frustration, are more creative, more flexible, and show a good school performance. All these achievements predict better health, better quality of life, greater academic success, better employment status, and a lower incidence of conduct problems in adolescence and adulthood. That's why executive functions are considered critical for children's healthy development and pivotal resources for school performance. Executive functions emerge in early childhood and present a lengthy development that continues until adulthood. Its lengthy development creates several sensitive periods in which brain plasticity is increased and the brain is more susceptible to the environmental influence. That's why executive function develop as a result of a delicate and sustained interaction between brain maturation and the influence of the environment. That's what it has been reported, that sensitive brain environment really strengthens executive function development, while a stressful environment impairs it. In the last 20 years, neuroscientifics has been very interesting in identifying contextual factors that model executive function development. For example, for the children, stress, brain maturation, for family, cognitive stimulation, rearing practice, stress, for school, school climate, quality of teaching, teacher modeling of EF, for community, social support, social belief, etc. So thinking in this ecological model of the development of executive function is that I start wondering in what way could the COVID pandemic affect the executive function development? And I have been thinking some avenues that could be of interest. First of all, child stress. As we have been discussing, child stress impairs cognitive function and could impair also brain functioning. Another interesting avenue is parental stress. We know that parental stress decrease involvement and sensitive to the children's needs, lessen interaction and communication, increase punitive parenting strategies, could increase family conflict, family violence, and unfortunately could increase child maltreatment. It has been documented recently that during the pandemic, there has been an increase in child maltreatment. Another avenue is the reduce of social interactions. We know children develop in everyday interaction with important others, such as peers. They practice the executive function in interaction with peers. For example, when they regulate emotion, they have to practice attentive listening, solve interpersonal problems, and be flexible by taking others' points of view. Another avenue is the unhealthy habits that children have been sustaining during the COVID pandemic. We know that it has been an increase in the abuse of screen time, in sedentary lifestyle, reduction of outdoor activities, in physical activities, in unhealthy eating habits. All of these factors really could impair health and by this way could impair cognitive functioning. A school closure is another avenue. Why? Because schooling really teaches executive function development. So the reduce in the schooling in this year is not only going to affect children's learning trajectory, if not, it's going to affect the development of executive function too. Another avenue that is for interest is the changes that has been done in child-teacher interaction. Why? Because teacher has a critical role as mediator of the cognitive development of the students. And also teachers model and scaffold executive function development. So how can we help children? What can we do to help them? Well, thinking in the SBFC meta model, I think that a school-based intervention and prevention program are an excellent resource, especially those interventions aimed at improving resources in family and school in order to assist children to cope with the pandemic. And here, a school need our help, need the help of the psychologists, mental health provider, social worker to create a sensitive trauma learning environment. I think that one way to do that is to embed into the school curricula activities and practice aimed at lowering student stress and fostering executive function. And here are some of the strategies I have been thinking on. For lowering student stress, I think it's important to create a safe and a predictable learning environment by identifying student symptoms of stress, by creating a school routine, by maintaining a clear and fluid communication with children, by empowering children with correct information about pandemic, by communicating the school emergency response plan in case the evolutionary of the pandemic change. Also, it's very important to create a well-being school climate. By being flexible, it's very important teacher could adapt task assessment in order to understand that maybe in this challenging time, learning is difficult for children. Another way is by strengthening relationship between children, between teacher and children, between teacher and parents. Another way is fostering express and regulation of emotion. Another way may be using mindfulness and relaxation techniques. Another way by promoting healthy habits, for example, incorporated in daily activities, some outdoor activities or some physical activities. And on the other hand, it's very important to foster executive functions. And there are very easy activities that we are able to embed into the curriculum. For example, for improving attention performance, it's important that teacher may observe a student attentional process, identify what tasks, what activities really capture their attention. Another way is by varying the stimuli and teaching methods, by providing clear instruction. This is very important. By shortening the duration of the activities, by encouraging self-assessment of attention. We know that pandemic really changed our life, and this is a great opportunity to train inhibitory control in children because they have to learn new rules to behave in school context. So teachers could scaffold the development of inhibitory control by simple things. For example, placing poster, visual signs, reminder to facilitate children to the internalization of the new rules. by role-playing, acting the new rules, by promoting reflection on behavior and emotion, by using relaxation techniques. And I think that it's going to be important to foster initiative because children maybe are less motivated, so it's interesting to foster initiative by, I don't know, playing a game at the beginning of the class, doing a stretching activity, doing a special welcome greeting. Working memory is another critical ability for learning. So it's important to improve this by, for example, starting a new topic, updating content learned, practicing mental calculation, using comprehensive reading techniques, proposing playful activities in which children must memorize some multiple step or action to reach a goal. We know that pandemic brings us uncertainty, so it's very important to foster planning and organization abilities. And teachers could do that, for example, modeling these abilities by creating a school calendar, using route maps to diagram the stage of the task to be carried out, and also the scalophone disabilities by assisting children in the use of the school planner and checking list, and by encouraging students to carry out projects and helping students, for example, by dividing a complex goal into sub-goals that are measurable, achievable, and specific, or by graphing the steps to achieve a goal. Finally, I think that it's very important to foster cognitive flexibility by modeling flexibility use in this time of crisis, by encouraging children to really think different approaches to a problem, by training perspective taking, using problem-solving techniques, and use brainstorming and role-play. But it's important that when teachers apply these techniques, they take every opportunity to highlight the progress of the students. And also, it's very important to create partnership with school personnel, school mental health providers, and community. And also, I think it's very important to create partnership with family. Here, it's important to maintain a clear and fluid communication with parents, involve parents in school activities, provide support to parents when struggle with homeschooling, for example, or listen to them when they feel overwhelmed. Here are some examples of how to do this. In Mendoza, I have run a professional teaching training courses that was requested by the Department of Education. And during the pandemic, I did 2 webinars for teachers. The first one was about education in time of pandemic, how to promote a student executive function. And the second webinar was about contribution of neuroscience to physical education. And now, actually, I'm working to design a virtual teacher training course that is going to be about neuroscience and physical education, which main goal is to train physical education teacher to embed into educational practices, playful activities aimed at fostering student executive functions. Well, here are my conclusions. We know that the pandemic has a significant impact on children's life, and the children's ability to overcome these challenges will depend on their internal resources and the support they obtain from family, from school, from health system, and for community. And we know that to foster children's healthy development, we have to establish a strong partnership between these social institutions. And I think really that schools are an excellent place for running intervention aimed at helping children to cope with the pandemic. But we have to point it out that a school system needs help to do that. In Buchahan's words, during a disaster, a school community needs additional coping strategies for school personnel, coping strategies for students, and coping strategies for the school family community. So improving teacher coping strategies is emphasized because teachers really play a key role in helping children to cope with a crisis. I think that training teachers in the application of evidence-based techniques aimed at lowering student stress and strengthening their self-regulation abilities is one way to do this. Finally, I think that this proposal shares the foundation of SVFC meta model and propose to consider this challenging moment as an opportunity to highlight school as one of the social institutions that play a valuable role in fostering the relationship of student health and education, create long-lasting bonds between mental health professionals, educators, and families, to improve educational practices, embedding within the curricula trauma-sensitive approach, to focus on family, school, and children's strength, and to listen children's voices, stimulate their active participation, and empower them as agents of change. Well, many thanks for your kind attention. I am here for your question. Thank you.
Thank you very much, Celina. That was a wonderful presentation, and what excited me was the way it ties into so much of what we have already heard today and also yesterday. And you're bringing in the executive function and the neuroscience gives us all an added dimension. And I think we have some hands raised. So Annemai and then Helen.
Yes, thank you so much, Celina. It was really, really interesting. And it's a wonderful, very sound and solid argument and rationale you have for why it is so necessary to build a didactics, as you have done, actually, a didactics for supporting executive function development trajectories. And I have two questions for you. One is, I love that you talk about this as trajectories organized and supported, scaffolded by the context of the children. So could you perhaps elaborate a bit on the theoretical background for using that conceptualization of development? That's my first question. And the second one is, it is as if your entire systems model would fit so well with the presentation we just heard. So could you reflect a bit on that? Because in a way you address it. And I think of the teachers also as overloaded with stress in these times. So this didactics for supporting executive functioning is quite demanding on the teacher's behalf. So that's why I asked to sort of reflect a bit on the former presentation where the teachers was the first order informant, right? And so how to care for them as well. But the first, the trajectory conceptualization, and then this systems approach. And thank you very much.
Thank you, Annie. Thank you for your comments and for your question. I think that your questions are very, very interesting. First of all, about the background. Of course, I have a background in neuroscience because I start studying in neuropsychology, but I always was interested in really comprehend how the environment could impact on child development in this case, cognitive development. So I have to go through different models, for example, Bronfenbrenner model. Then I really take Vygotsky into my think, because I really think that children develop their cognitive function, this one that are executive function, yes, as an example, in their relation with others that help them to really develop these abilities as children develop others' abilities. So I think it's very important. And in this way, when I have been studying, I have been thinking in teachers and in parents too. But in the last year, in the first year, I started working with parents, training parents to foster these abilities. But in the last year, I have the opportunity to work with the Department of Education, and they asked me to train teachers. That's why I really start training teachers, because I really think that they have the ability, the role, the important role of being a mediator of cognitive development. So I think it's important that they really recognize this role and start thinking in a different way. So I have been going through different perspectives or different models where I have been trying to create a more widened approach, because I think that neuroscience needs to take in consideration the environmental, the context, because if not, we can not really think in a whole way and to consider how children really develop healthy and well. This is the first question. And the other, yes, I've been thinking a lot. Really, a previous presentation made me think that I should have talked briefly about teacher self-care. I really consider that we have to help them, but first of all, we have to hear, to listen what they need, what they really need in this challenging moment. And that's why I really point out that it's very important to create parentship, that children don't have to be alone. The school system don't have to be alone. Here in Argentina, we have a very difficult situation because, for example, in our elementary school, we don't have mental health professional working there. We have, for example, one mental health professional for a lot of school. So really the support is very, very few. So I think this must change, and we really have to go to school and really help teachers, principals to create, as Kat have been said, a system with support each other. So I think this is very important. Thank you. Thank you for
Thank you very much.
Helen and then Jackie.
Yeah, I want to tell you how much I appreciate this talk, because executive functioning is just a skill that kids have real challenge with when they're having academic challenges. And the way you tie it with emotional well-being and the effect of pandemic and the stress and how it affects kids and how executive functioning is affected and how we support students in their emotional needs, and then we help with executive functioning. The connection that you made was just wonderful. And the systems that you're talking about, I totally agree that the teachers have a lot to do with promoting that executive functioning, but teachers are so concerned about teaching the content that often forget about the executive functioning of kids, and they just say the child has it or doesn't have it, and kids suffer because they may lack the skills. And so the whole ecological model that you bring in and really working with teachers is just, where my heart is as well. And just, at any age level, I remember your talk last year about helping younger kids, right, with executive functioning, but older kids have the same problem. They have difficulty with executive functioning. And so, like, how would you accommodate for different age and their need for executive functioning development? And that would be my question.
Well, thank you so much for your comments. Yes, it is really a challenge, but I have been working in the last 3 years with elementary school children and with middle and high school children. Because I think that the suggestion, if we have the recommendation of the strategies for children, we have to adapt it to each level. I think it's very important to work in collaboration with teachers and rethink these strategies. But the essence of these strategies are very easy to embed into the curricula. So what I have been done in one of the courses that I have been running is to help teachers with some guidelines to how to embed into the curricula the promotion of the executive function with a very, very easy and simple actions that they really feel that they already do that, but now what we are going to do is to do it this regularly. I try to tell them that we only can impact on development if we really do things systematically. If not, changes are not going to happen. And they have a lot of opportunity to do that. So we have been creating some examples of curricula where we embed with different, for example, history, science, literature, maths, with created some curricula where they really embed some strategies to foster executive function. Of course, that in this case, I have to work with teachers because it's very difficult, if not to give them a recipe. This is not my intention. My intention is to really approach what neuroscience has tell us and to dialogue with teacher and create some new educational practices.
Thank you.
Welcome.
Thank you, Helen, for your question. Animai, I had the feeling that you had maybe a follow-up to your to the answer that Celina gave you to the previous question.
I think Celina gave an excellent answer, because I really love the idea that you are trying to be able to, on a very solid ground, to make practitioners understand the reality of what they are doing. It is sort of, it is into the matter of the body. It is really, it's the matter functioning, or the embodiment of becoming of children as they grow into what is culturally and socially organized by the adults. And therefore, I think it's such an important work you're doing. So in a way, it's not really something extra, Peter, but thank you for giving me the time to say this as well, because I think it's such a wonderful work you're doing, Celina. So thank you.
Thank you. Thank you so much. Thank you.
Thank you, Animai, and I love the gem you just gave us of growing into the world that is culturally organized by the adults, and that is something that also addresses Kathy's presentation. So we have Jackie and then Gertina, and then I think Suzanne. Jackie, you have your hand raised for a question. And you might.
Can you hear me now?
Yeah.
Yes.
Oh, perfect. Sorry. I'm always excited to see and hear Celina from last year till now. This never before has been a time, I think, when school-based family therapists and educators and families and parents and teachers all got together in such a dramatic way with the pandemic. I mean, there's nothing ever going to be like this, I hope, again. the intersection. The most amazing thoughts that came up when you talk about the symptoms of children and the stress really gives me a thought to say how unfair and how untimely it was to minimize children's reactions to stress in the very beginning of our pandemic. It was as if to say they're unscathed, they're going to be fine because they're children resilient. Well, we're looking at your talk today and we don't see that. So I don't think it's too late. My other thought was the fear of the unknown is the worst of all our emotional states in life. And part of this is the fear of the unknown. The teachers, the educators, the people, families, we all don't know what's going to happen either. So you use the word uncertainty. That is a primary place to start your pioneer work with your longitudinal studies. I hope that will take place because it's going to be something that we can look forward to hearing your work, Celina, because this is not going to go away so soon. We thought the vaccine would handle it. Now we have a variant. So the uncertainty still continues. And we don't know the additional physical, emotional, and genetic stress this is going to take us. So we need you to keep doing the research. Thank you, Celina. Thank you.
Right. Thank you, Jackie. Thank you for your
I'm putting it all on you. Our hopes are on you. No pressure.
Thank you. Thank you.
Actually, yes, I also want to thank you, Celina. It's really wonderful to listen to you, as always, and to hear your insights and finding a different kind of insight into all of what we are talking about. It's often we forget the individual development that is important, the child's development. Because we focus so much on the parent-child relationship, this parent-school relationship, and all of these, but then to forget that the child is important. But this made me, and some of the questions actually now, made me think also that you are fortunate in one way if you are invited to do some curriculum changes and adaptations. Because one of the big challenges is that teachers are confronted with a curriculum that they have to transmit to children, to give to children. So they have to give their knowledge and the child has to tell them, I have now absorbed the knowledge. But that is not learning. That is not how we should look at education. And the curriculum are sometimes so filled up with things required by some national qualifications authority or some policy that somebody has put in place that they forget the individual, the microsystem. I was wondering how you approach this revision of curriculum to focus on the executive functioning of the child's development with the policymakers, the ones who determine what should go into the curriculum. Because if the government says you can't include socially relevant information, social justice, whatever, I mean, in America, you're now struggling with the people that are against the critical race theory or whatever, the misinterpretation. How are you bringing in things that are really necessary for the child, for their development, if you need to speak with the policymakers? This goes also to the macro system that Kathy talked about in the previous system, and the systemic change, third order systemic change that we need to make. The policymakers need to hear your speech.
Yes, Gertina, I really agree with you. It's not easy. It's very difficult, and it's changed I don't say every year, but at least in 2 or 3 years, because when the authority change, they have another interesting, and it seems like they forget everything we have been doing. So it's not easy, but I don't know why I have the fortune to give a talk to teachers. And this really called the attention of the persons that were in the Department of Mendoza education system. And they invited me to continue giving these talks and to develop courses. And then they really give me the opportunity to write, I don't know, 5 pages, I don't know if less, in the curricula of the Mendoza elementary school. And well, this really helped me to reach more teachers that were interested in that. And I have been done courses in private school too, that they really was interested in this topic. And well, this is, I don't know why, but it's happened and it was wonderful. I really didn't know that it's going to happen. And when it's happened, really, it was wonderful because we could work together. And I really value the work with teachers because I have learned a lot. Really.
Great. Great. Please pursue this and give us some clues in other countries. How we can convince the policymakers that they need to. Maybe we must get you to come and speak to our policymakers so that they can also say, oh, wow, great, we want to come and hear you more.
Okay.
Thank you, Gertina. And we have now Suzanne Bester from the University of Pretoria, who will give a closing appreciation for Celina. Suzanne.
Thank you, Peter. I know that you cannot see me. I made the decision entering the session not to activate the video for some other reason, and I think that was a mistake. So you can't see me, but you can hear me. So Celina, when I was asked to do the summary of your presentation, this started very early before your presentation. So I first had a look at your bio sketch because I really wanted to get to know you as the researcher behind this presentation. And I had a look at the abstract that you submitted for your presentation. And what I saw there excited me and it piqued my interest. What excited me was the prospect of listening to a presentation by a scholar who has very clearly been focusing for many years on research that focuses on neurocognitive evaluation and the design of ecological interventions that promote cognitive development in children. Now, this aligns closely with my own interest in neurodevelopmental disorders in children and adolescents. And it is especially your extensive experience with the implementation of intervention programs in schools in Mendoza since 2009, which made me realize that we have much to learn from you in this presentation. Your applied experiences in training principals, school health professionals, and educators in Mendoza in the schools, I believe, certainly had the potential to make your presentation very rich, valuable, and meaningful, and I certainly looked forward to it. And I was not let down, and every expectation I had about learning how evidence-based approaches could promote students' executive functions and how this could be integrated in school curricula was certainly met and exceeded by your presentation. Now, we know that teachers are at the forefront when it comes to managing and mitigating the harmful effects that children experience when they are exposed to traumatic events in their lives. And globally, every single nation and every single country has children who are affected by the devastating effects of the COVID-19 pandemic. And of course, teachers have never played a more important role in the lives of children than right now. And this is what gives your study and your research scientific relevance. It has the potential to increase our understanding of executive functioning in the context of trauma, and it is relevant to societies across the globe. I appreciate that teachers are the specific focus in your research. This is because we know that the very important role that they play in children's lives. But there is also enough evidence that show us that we do not spend nearly enough resources on their professional development and to enable them to competently address the very complex issues associated with children's learning and development. And your study certainly creates the potential to address this. What stood out for me in your presentation was that you reminded us again how emotional distress and trauma can impair adaptive coping and how this negatively impacts children's overall functioning, but especially how it affects executive functions, which is one of the most vulnerable cognitive systems that influence children's abilities to use working memory, to be flexible in their thinking, to control their behavior, and of course, to exercise attentional control. Your presentation also foregrounded how difficulties with executive functions affect all aspects of children's school careers, and that it only makes sense to find strategies and techniques that can be integrated in the school curriculum and that could be delivered by teachers. I want to thank you for doing the hard work of reviewing various scholarly resources that have been published in the last 11 years and to extract those strategies and techniques that have been reported on in research that could manage the signs of traumatic stress and that could assist in strengthening executive functioning in children that could benefit them in their development. I leave from this symposium inspired by the ideas that you have instilled in me in exploring the teaching strategies that we can use to manage stress in learners and to foster executive functioning and development in them. And of course, I think that what I've learned from the symposium and from your presentation is that I can take these strategies and integrate it into my own educational psychology students' curriculum to enable them to facilitate support and change in schools in South Africa. Well, our students work in contexts where there is great trauma and poverty, which means they will use your research for many years to come, even when COVID-19 has already been put in its proper place. Your study and your presentation is a really good example of how we can turn lemons into lemonade. And I would like to ask the group to follow me in applauding your presentation and your contribution at this symposium. Well done.
Thank you, really, really, thank you. Yes, thank you to all of you, really. I really emotional and I'm very happy to share with all of you, and really, thank you very much.
Thank you,
So,
Celina. It was fantastic.
Thank you.
Thank you, everybody. Thank you, Suzanne. Thank you, Celina. Thank you, Kathy and Sibnath and Harold and all our presenters today. And we will see you tomorrow at the next session this year's
Thank you, everyone. Have a good day or night.
Take
Thank
care.
you. Same to you
Bye,
guys.
Katina. Bye, Peter. Bye, Celina.